Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Let's look at the precursor lesions, and this is the hepatocellular carcinoma. So to begin with, the hepatic adenocarcinoma, hepatocellular adenoma. So here, is it pre-malignant? The answer is yes, it is pre-malignant. And is it associated with cirrhosis? It is rare. The cirrhosis involvement is rare. Commonly associated diseases, it includes the NAFLD, standing to the non-alcoholic fatty liver disease. There is the oral contraceptive pills. There is anabolic steroids. There is also the glycogen storage disorders, GSD. Now, moving on to the small cell diseases, small cell change. So, small cell change, there is pre-malignant, yes, associated with cirrhosis. The answer is yes. Now, what are the commonly associated diseases? Commonly associated diseases, it includes the HPV, then comes alcohol NAFLD, then the alpha antitrypsin deficiency, alpha 1 antitrypsin deficiency, the hereditary hemochromatosis, as well as the primary biliary cirrhosis. Looking at the large cell diseases, large cell change. So here the pre-malignant, is a pre-malignant, it is in some cases of the HPV. And is it associated with cirrhosis? The answer is yes. And what about the commonly associated diseases in large cell change? It involves the same as in the small cell change, that is the HPV, HC, then NAFLD and primary biliary cirrhosis. Then moving on to the low grade dysplastic nodule. This involves the uncertainty of the pre-malignant and the associated with cirrhosis. Is it associated with cirrhosis? The answer is yes, it is associated with cirrhosis. Next is we move on to the changes, commonly associated diseases. It is same as in the small cell change. Then we move on to the high grade dysplastic nodule. So here is it the pre-malignant and associated with cirrhosis? The answer for both is yes, and the findings is same as the small cell change diseases. To learn and grow daily like this, please do subscribe.